hospitals, and we have got registries. So we have got, as you can see, that we have got this a vibrant network, and we have got 36 population and 236 hospital-based cancer registries. So they are population-based registries and hospital-based registries. And these are the registries which we have in the country. And our patients are being sent to these places. So if you look at it now, the final figure is that there are 28 population-based cancer registries and 58 hospital-based registries. Number is increasing, increasing, increasing. So they are the places where patients are being sent for better care. They are in the population based, all are run by the government, which guide the people what to do. But unfortunately, they are not told to navigate. But they're all run by oncologists. They're not told to navigate the patients back to ART team, where they can give them some treatment. And they themselves are too busy in the cancer work. So patients are not getting the right outcome, though they are present all over the country. They are not being navigated. और अगर नेविगेट भी होगा तो हमको पता नहीं हमने क्या करना है. And I tell you that today's talk is a lot about the social causes. So please be with me and understand how we are suffering. 1 in 8 cancers, Indians are going to have a cancer. 1 to 8, surprisingly. And I find such young people getting cancer nowadays, cancer of tongue, cancer of brain. Young boys and girls are having cancer. So we may wonder, but if you look inwards to your family, you'll find same people. Same thing will be happen to you also. 1 in 8. In case you are from Aizol, 1 in 4. Aizol, 1 in 4. That's a cancer. It's like an epidemic. And Northeast has got large number of cancers, and Aizol in Mizoram is the maximum for the male, while the Papumpare in Arunachal Pradesh is for the female. So basically, it's all about Northeast, where they have more cancer in many reasons, but they are the people who are giving us problem. And this is the way here we have to focus more. But that's what the ICMR. We as doctors are looking at our own little parts where we are working. So these are the population-based registries and hospital-based cancer registries where we can refer our patients. And they have made 6 zones in the country. There are 6 regions, as you can see here. 1, 2, 3, 4, 5, 6 regions they have made. And these regions, we can refer our patients. And they are north, south, east, that way they have made it. So first of all, as doctors, if you get time, पहला काम क्या करेंगे आज हम देखेंगे कि हमारे आसपास जहाँ हम रहते हैं वहाँ पे नियरेस्ट हॉस्पिटल बेस्ड रजिस्ट्री कौन सी है और पॉपुलेशन बेस्ड रजिस्ट्री कौन सी है हर स्टेट के अंदर है. Once you find out, you know that where you can refer the patient in case you need any help. That's very, very important. So there are many government medical colleges, as you can see here. A lot of good colleges, Amrita, Kochi, down. They've taken good medical colleges, good Tata Memorial, Gandhi Medical College, Bhopal. They are all the hospital-based cancer registries. And there are operation-based registries. They are the people whom you can approach and have a tie-up with them. Go to them, ask that in case you have any problem, can we connect with you? And they can refer the patient back to you. So they also need help. And probably in case you can do it, please give me a small promise of the day of Rakhi that you all are from, many of you are from tier 2, tier 3 cities. Go to such places and do a small CME with them. The CME doesn't mean that you spend a lot of money, but do go and educate them about what can be done with young people. That is your moral responsibility. I say social, spiritual, but it's moral responsibility. I think we all should do this work as far as possible, as soon as possible. So cancer burden in India, as per the fact sheet, is going to increase and it is increasing. The cancer burden in India is probably the largest in the world. And this is the common cancers. And I think cancer cervix is killing large number of people. Cancer breast is coming at young age. So we are in a mess. Actually, our country is in a mess with the cancer. And I've seen such young, healthy people who get oral cancers. I don't know how they are getting so many oral cancers. So, so we have a large chance of getting a cancer, all of us. And as they say very clearly that maybe 1 in 8 people may get a cancer, but some cities there may be more, and is 1 in 4 in Meghalaya, Arunachal Pradesh. So depending upon where we are in Delhi, it may be 1 in 6. So you can calculate your own risk. And when time has come that you do such good amount of work, you should always also try to find out how we can help the community to benefit with your knowledge. So with this, I will go to my next slide. I'm sorry, I lost the track. So what is fertility preservation? Who will tell me what is fertility preservation? I want you to be like little babies again and attempt telling me what is fertility preservation in simple terms. Simple terms. क्या होता है ये?
Sir, good evening, sir.
Good evening, Sudhir. Hi, how are
Sir,
you?
fine, sir. Thank you, sir. Sir, fertility preservation means if a patient having any disease or like the ovarian disease, having the carcinoma, and where we want to preserve her fertility for the time being, so that we can give the chemotherapy and any drug, so that we preserve her fertility, and after then completing our the surgery, are giving the chemotherapy, we re to give treatment for her fertility, or give, we can preserve her ovary or anything, sir.
So I think you are 25% right, Sudhir. 25%
Yeah.
right.
Oh, yes, sir. Yes.
Only 25% right. I'll tell you how. So no problem. But you attempted. Navid, how are you? हमने नाविद को मिस किया था during hands on Navid. We missed you. So
Yeah, I am fine.
I know you had a visa problem. So, but we missed you. So, hi Gauri, how are you? Good to see you, Gauri. So, fantastic. Gauri would like to attempt. What is fertility preservation? Can add on to Sudhir. Any one of you. हम तभी
Basically,
सीखेंगे.
process of oocyte preservation may be because of social reason, because of some gynec pathology like ovarian adenomyosis or endometriosis. That is called as fertility preservation.
Disease. We've spoken about diseases. Anything
गुड
more?
इवनिंग
Any
सर
disease? Good evening, रूबी. क्या हाल है तुम्हारा? कलकत्ता
बिल्कुल
वाली
ठीक
रूबी है
सर
ना?
जी सर जी सर
कैसी है बेटा तू? अच्छी है?
बिल्कुल ठीक हूँ जी सर आप कैसे हैं सर
बहुत अच्छा, बहुत अच्छा। तो बताओ, आप अटेम्प्ट करो, क्या होता
तो
है?
सर
देखो,
इन माय
फंडा इज वेरी क्लियर। आई एम टेकिंग अवे वैल्यूएबल टाइम एंड अनुराधा एंड मी आर सिटिंग विद यू। वी वांट यू टू अंडरस्टैंड दैट टॉपिक। हम चाह रहे हैं आप टॉपिक को समझें। एक
जी
पावर पॉइंट का तो कुछ मजा ही नहीं आता ना। कनेक्टिंग विद माय लिटिल सिस्टर्स एवरीवेयर अराउंड इज वेरी इंपॉर्टेंट, एंड
जी
गुंडा ब्रदर्स आई हैव सुधीर। सो
so
बता
sir
रूबी क्या होता है
so
और
fertility preservation is for both, for males and females, for any of the reasons. There can be many reasons. Maybe cancers could be the reason in both. Maybe for female is low weight reserve, or maybe that the female is not ready for pregnancy yet, so they might consider preserving or freezing their eggs. Or for males as well, if they are undergoing something, and sometimes there have been
गुड,
females
फैंटास्टिक, गुड
have
गर्ल।
a with
व्हाट
the use
व्हाट मोर?
itself.
एक्सीलेंट रूबी,
What
एक्सीलेंट।
more? So I can think of.
फिफ्टी
Thank you
परसेंट
so
कवर
much,
कर
sir.
दिया तुमने। 50% तुमने कवर कर दिया। सो सुधीर पे तुमने 25% ऐड कर दिया। सुधीर 50% ऐड हो गया तुम्हारे ऊपर। एनीवन एल्स?
Good evening, sir.
ओके।
Good evening, sir.
हाय बबीता, हाउ आर यू?
Hi, sir.
बबीता,
ठीक हूँ मैं,
बबीता,
बिल्कुल ठीक हूँ।
इज इट बबीता
Sir,
स्पीकिंग?
yeah, Babita is speaking, sir. Hello. Good evening, sir.
हाँ, बबीता सो एंग्री विद मी। मैंने वोटिंग
Oh,
करा,
no, no,
मैंने
sir.
वोटिंग
Never,
करा अभी।
never,
मैंने बोला किसको
never,
समझ में नहीं
never. Sir,
आया।
any disease process
बोलो बबीता।
affecting the reproductive tract of female or male. So we should plan the treatment in such a
हम्म,
manner with by preserving our affecting least with the reproductive efficiency.
मैं 2 चीजें और ऐड करना चाह रहा हूँ जिसके बारे में बात नहीं कर रहे हैं.
Sir, actually, now, yeah, they have talked about what it is. Then we have different methods for fertility preservation. Like we can go for ovarian tissue preservation.
Taskin, can you put the camera on, beta? Camera on कर सकती है, so we see you.
1 second.
We're very happy to welcome you. We have not met you, Taskin. I don't think we have met you before. So, guys, today I'm gonna go like this only. Very slowly. Some of you may feel offended, but I want it should be more of this talk is more for the country today, where everyone understand what is fertility preservation and not rush through some definitions. Yes, Taskin, tell me.
Yes, sir. So my friends have talked about what it is and why is it done. Then there are different methods by which we can go for fertility preservation. Like in females, we go for ovarian tissue preservation or in vitro maturation of oocytes and sometimes ovarian transposition. So these are some different methods which are involved in fertility preservation, and the reason could be, as they told, the social reason that female is not ready to come back the motherhood, or they want to delay the pregnancy, or some conditions which affect the fertility, so that they can have